Good evening, viewers. You're welcome on another exciting moment with Kidney Foundation brought to you by St. Remy Foundation. Kidney Matters. I am Ngorka. Yes, so on the program, we have so far been talking about the importance of taking absolute care of your kidney, living healthy. And I want to tell you, it is not just a kidney. It is your system. It is your body system. Yes, though that St. Remy have taken it upon them to take care of this very aspect, educating us and enlightening us on what we should know and what we should do. But then, it is more than that. It is not just your kidney. It is your whole system. Your life, your healthiness of your life is yourself. It is your duty to make sure that you always take absolute care and take precautions on what you eat, where you go, things you involve your life with, avoiding toxic things, inhaling things that can endanger your system. It is your duty. It's not anyone's duty. Yes, so St. Remy have done a lot by bringing this very aspect, by taking care to make sure that we are informed about this very aspect of our system. But then, every other thing, like we tell you, make sure that you know your blood level, your health status, every time your sugar level, salt intake, all these things are very, very important. And above all, they say that when you are healthy, you are wealthy. So there is no other thing more than this. But then before we continue on the program, I would like us to look into, see some insights on kidney. And I will come back with what we have today. Just sit down. You will get a lot from this very foundation, from this very program, Kidney Matters. It is a vital program for you that will always educate you. Studio bring to us insights on kidney, and we will be back.
Regular primary kidney transplantation into the right iliac fossa is shown. Some technical details are provided that may require basic surgical and anatomical knowledge. The procedure starts with opening the skin in the lower abdomen with a surgical knife. The hockey stick or oblique incisions are most common. The length of incision depends on the habitus of the patient and ends 2 cm above the pubic bone, which allows access to the retroperitoneal space, the iliac vessels and the bladder. The subcutaneous fat is incised using electrocautery. The fascia of the external oblique muscle is incised diagonally. The combined fascia of the internal oblique and transverse muscles is incised in a more vertical fashion. The preperitoneal space is exposed, and the inferior epigastric vessels, as well as the rotund ligament in females or spermatic cord in males, are identified and secured with a vessel loop. The lowest part of the posterior rectus sheath is incised. After this, the retroperitoneal space is reached by gently pushing away the peritoneum. Its contents are held by a retractor. The common external and internal iliac artery and vein are identified and dissected from fatty tissue and lymphatic tissue to make clamping of the vessels possible. The iliac arteries are investigated by palpation for atherosclerosis. The kidney is now retrieved from cold storage. In this animation, it has already been prepared for transplantation and pre-transplant biopsy has been taken. Corner stitches are applied to the renal vein edges. The kidney is placed into the iliac fossa in the best possible position, and the length of the renal vein and artery may need adjustment. First, the vein-to-vein anastomosis is done. If needed, the iliac artery is retracted very gently to improve access. The iliac vein is clamped and cut. And the incision is extended. A supporting pull-out stitch is placed on the medial side to keep the lumen open. A heparin solution is used to rinse and clean the lumen from blood and small thrombotic material. The renal vein corner stitches are connected to the corners of the opening of the iliac vein, and from one corner the venous anastomosis is performed, in general by using a 5-0 unabsorbable monofilament running suture. The supporting stitch is removed and both remaining sutures are knotted. Next, the iliac arteries are clamped. The artery, preferably the common iliac, is incised and the opening is enlarged using a 4 mm aortic punch. The artery is cleaned with heparin solution. The arterial anastomosis is now performed using a parachuted 6-0 unabsorbable running suture. Before reperfusion of the kidney, the renal artery is clamped close to the anastomosis. This is done to prevent blood clots to go into the kidney. First, the arterial clamps are removed and the anastomosis is checked. If there is no major bleeding, the other vascular clamps are taken off and the kidney is reperfused with blood. Over time, the kidney color should change to a more pink aspect. The kidney is warmed up using warm saline solution and the kidney and the vessels are checked for bleeding. When the perfusion of the kidney seems to be appropriate, the anastomosis between ureter and bladder is performed. Through the urinary catheter, the bladder is filled with saline. The ureter is cut to the right length, and the lumen is spatulated by a longitudinal incision. It is dragged under the epigastric vessels and spermatic cord to the bladder. Production of urine may be observed at this stage. The bladder is now opened, first the muscular layer and second the cerebromucosal layer. Corner stitches are placed between the urinary bladder and the ureter. The ureteric stent is inserted. The ureter bladder anastomosis is now performed using semi-absorbable 5-0 running suture. The anastomosis is retracted into the bladder and the muscular layer is closed over the ureter anastomosis to create a valve effect that minimizes urinary reflux. When hemostasis and kidney perfusion are adequate, the peritoneum and its contents are placed over the kidney. The posterior rectus sheath is closed first. Then the internal transverse fascia is closed, and the external fascia is closed, all of them using semi-absorbable suture. The subcutaneous layer and the skin are closed using absorbable sutures.
Welcome back. Hope you enjoyed that package on kidney. All right, like I was telling you, we have we have had a lot of experts who came on this program to tell us the importance of we knowing our kidney status, the importance of we knowing the type of lifestyle that we engage in. And last 2 episodes before this very episode of today, we had a kidney patient, a survivor, who was here to share his experience with us. And he told us from the inception, from the time that he was diagnosed, the experiences, how it came to be, and how it was discovered that he actually had this kidney failure. He told us even from the time that he went, how many dialysis that he took before finally he went for the transplant. And today on the program, we're expecting to have him again to share the end part of that very experience that he shared with us. We are hope to join with him on the Zoom, but while we are waiting for that to be connected, I still want to let you know that it is your duty to make sure that you are healthy. Your body is your body, it's not my body is my body. I am the one that will always know what I engage with. I will always know what I take. I will always know the kind of places I go, the things I drink. These are what this program is actually bringing to us. Like I rightly said, when we considered a lot of factors that could bring about this very kidney problem, we looked at factors like hypertension, which from the experts that were on this program, they told us when such thing are being diagnosed and is not properly taken care of, adequate drug taking in order to make sure that it is completely being eradicated, being cured, that it can develop to the extent of affecting the kidney. Now, when we looked into that, they told us that this very hypertension, is a gradual process that even sometimes you yourself may not know that you're already having this hypertension, but by the time it comes up, because it doesn't really have symptoms, if you are waiting for a symptom, by the time that symptom would have come, that means it have graduated to a level of endangering the system which we are trying to protect. So they told us that one of the things we should do, the expert that was here, that was 2 episodes before now, told us that the best thing we should do, one, proper check. Make sure you visit hospital at least in 3 months' time. One is expected to visit a hospital so that you can be tested, your blood level, your sugar level. All those things are very, very important. Now, by the time you know it, and even last episode, we have the CEO of St. Remy Foundation, who told us that in his own calculation, that the best way to eradicate or to treat this very problem is maybe while people are about to enter school, there should be check. That is to know one's genotype of blood. There should be a thorough check of body system, organ, how they function, the status of one's health. That then, if it's being picked early, it will help to treat it so that this very kidney will not pack up. According to him, he said earlier dictate of this sickness or symptoms would go a long way to help in people treating it on time without actually coming down with this very problem. So today now, I am telling you, I don't know. Have you checked your system? Have you gone to hospital? What are you engaging in? Do you eat anyhow? Do you smoke? We know very well, even health, Ministry of Health, they told us that smokers are liable to die young. But to my surprise, people don't really adhere to these instructions. They go about smoking. Some can even finish a pack of cigarettes a day. The medical expert that was here 2 episodes before now, he told us on this studio that even him, he doesn't know how alcohol tastes, that he doesn't take it because there is nothing it can offer in his system. As a result, he don't know how much it costs in the market. So I don't know what you are engaging in. I don't know the type of life you engage in. Do you engage in the life that can endanger your system? Do you know that when one die, that is, life is just one. You don't need to involve in anything that can endanger this very health, this your life. You don't need it. You need to take absolute and proper care. Think of what you take. Think of the food you take. Like we were warned that maybe after cooking, the salt was not enough on your food. You went on adding salt is improper. It is not supposed. Whatever you add in your food while cooking, allow it to be. Some like excess salt. It is not good to the system. Just moderate. Moderacy is the key. You don't allow it to be excess. And all these things are what we, myself, yourself, need to know and need to do for ourselves. so that in this very, you know, like we are telling you on this very program, that kidney is a sickness that, in fact, to me, in my own analysis, I said it's a big man sickness. Why do I call it a big man sickness? Because what is involved? Think of the dialysis alone. A patient told us here that he underwent a dialysis of 108 something times. Now, each dialysis, according to the medical expert that was here, said at least in a week, a dialysis should be costing 200,000. That is an amount that is already certain. But there are other expenses that could be incurred even at the process of this dialysis. Like, for instance, leaving your house, the calling Uber, because one that have this very sickness doesn't have enough strength maybe to walk down to the bus stop, to start struggling for bus stop, for vehicle. So in that case, you are expected at least to call an Uber. Okay, these days we know what fuel is costing. When you think of the cost of fuel and you think of the duration via which you can travel before you do this very dialysis, you find out that you need not to engage or to have something that could endanger this very system. You don't need it. That is why advocacy of this very sickness is what Saint Remy is here doing. My brother, my sister, make sure that you are living a clean life. You avoid things that could endanger your life. While we are waiting for this, our very guest who will be joining us via this very Zoom, I would like us again to go to the studio to so that they can also play again this very kidney. You will learn one or two things on the functions of the kidney and how it operates. Please, studio, bring. All right, I know.
Healthy kidneys are essential for maintaining normal blood pressure. Each kidney has thousands of blood vessels responsible for filtering large amounts of blood. Over time, high blood pressure can cause these vessels to narrow, weaken, or harden. This damage then prevents the vessels from delivering enough blood to the kidney's nephrons, which keep the body's fluids and nutrients in balance. Each nephron receives its blood supply through the glomerulus, a ball of tiny filtering vessels. When the glomerulus loses its blood supply, then the filtering process slows down. This leads to a buildup of toxins in the blood, while important nutrients like protein are lost in the urine. This is the start of a vicious cycle in which blood pressure becomes harder to control and kidneys become more damaged and eventually stop working completely. This process occurs over the course of several years, but can be prevented with proper care. For more information,
Welcome back. The network is not really friendly with us today. Our guest is finding it very difficult to connect through the Zoom. That is why we are as if we are having hitches. But at the same time, if he will not be able to join us today, the next episode, by God's grace, he will be joining us, because this very experience, I know it will help someone. I know it will help you, so that you will know the importance and how you can go about it. If you are already brought down by this very ailment, there is hope. All hope is not lost. Yes, so there is help for one that is living. And I know you that is watching me out there, the Lord is there touching you. God is touching you. But one thing first, take absolute care. Take responsibility. It's not anybody's responsibility but yours. The responsibility is you that will take it to live a healthy life. So, like we always say on this program, we have a lot of things that we are taking care of. Like you've seen, a lot of people out there doesn't know how to go about it. But when they come through this program, they will understand that they can actually do a lot of things in order for them to live, even when they have already diagnosed, because some, when they have this sickness, they don't know where to go and they don't know what to do. That was why last episode on this program, we tried to campaign and try to employ governments in order for them to know what to do. Just as even before this program started now, like I said it last week, we saw the campaign on cholera, that cholera is out there. It is raging. It is working, doing a lot of havoc. But when people know about it, they begin to take care. They begin to know what to do. And that is what we did last week. We tried to tell government to come in this very campaign against kidney. That government, they can actually do a lot of things. Put that is health centers where people with this very ailment can actually go, where it can be picked on time, and the government could take a lot of responsibility, like looking at the dialysis, the equipments involved in dialysis. All of them are really at the high, that is, the price is enormous. Government need to come in. They can play a part. Why those people importing it, those people that are into it can actually bring down the prices, whereby government, like we cited examples of polio, where government have already taken adequate care of all the treatments, all the medications. They go house to house to make sure that the children are really given this polio. We are asking government to do the same thing on this very ailment. It is raging the society. We don't know it, but it is happening. According to research, it was observed that in every 10, there must be at least 2 or 3 with a kidney. It is in our society, but we need governments to really come up to things that will help in order for the patients who are going through this very problem to know what to do. Think of people bringing out as huge amount as 20 million just for a transplant. But we know that this very 20 million, if we put it in our economy, it can do other things. So governments have a lot to do. We are campaigning and asking governments, please and please, come and help us to make sure that our society is free of these ailments. All right, I always tell you, because of so many responsibility that St. Remy Foundation is having in order to make sure that people, candidates, and anyone that has this very problem that comes to them, they take absolute control and the charge and the help to their best. So we need people to actually help us and donate to this program. If you want to donate on this program or bring in your advert, you can always call us on 08034 964797. I come again with that number, 08034 964797, or you can also call us on 08033448093. That is a number you can reach us with. Or you have something to donate, you can always donate to this very account, 0260197596. That is GT Bank St. Remy Foundation, or First Bank 2029373062. We need your support. We need to remain on this program. You can see the experts we have been bringing on this program to educate you, to tell you what you need to know. And you can actually call these experts so that they can direct you, so that they can monitor you if you're already having this ailment. That is all that St. Remy is doing. So kindly help us to remain on this program. You can always call us. Our numbers are available at any time, because this is what we have taken in order to bring our quota to the society to make sure we have a society that is free of sickness. I am Ego Ngorka. I will come till I come your way next week. I remain as Ego Ngorka. Just stay tuned always. Bye.